Like other providers, neighborhood health centers have been challenged by the pandemic, but as part of the frontline response to it, they're more important than ever. At the Dimock Center in Roxbury, that can mean everything from COVID-19 testing and emergency food relief to new ways of continuing programs for substance use disorder. To bring us up to date is the center's new president and CEO, Dr. Charles Anderson. Thank you very much for being with us, Doctor.
Thank you for having me.
Doctor, I want to, I guess, introduce you to the viewers and have you talk about your background. This is not just about your professional career, but I guess it's really about the models for care and service in your own family. So tell us a little bit about that.
Sure. Well, I grew up in healthcare. This is a big part of who I am. Grew up in Buffalo, New York. My father was a family practice doctor, immigrant from Jamaica, came here to the States primarily to pursue his passion to become a doctor. And that's what he did. I think important to the story is that he was a family practice doctor in the early 70s when he started practicing, when there weren't a lot of the things around that we have today. There were no electronic medical records. He found himself, and we found ourselves, because I was actually a young boy at the time, spending a lot of time in the practice. We find ourselves really thinking creatively and problem solving. So what did we do? We put a lab in the practice so we could make sure that people had not only readily access to get those lab results to us, but quite honestly, we were able to get those lab results without getting on the phone and trying to track them down. And having that immediacy to the information was so important in terms of driving good care. We did the same thing around other things. And it's really very similar to what we do here at the Dimock. It's how do you bring all these services into one place, creating easy access, not only for the patients, but for those who are providing care. So I grew up with that being the model of what healthcare is supposed to look like.
And if I'm not mistaken, you learned something about problem solving from your mother too.
I did, as a matter of fact. My mother grew up in the deep South, Jackson, Mississippi, migrated to Buffalo, New York. Common theme there, leaving warm weather to come to cold weather. But that aside, she pursued her master's in economics, and she really leveraged that in the community as a real community organizer in helping to keep people in their homes, helping to keep people's heat on, working with National Fuel Gas and other companies. So we grew up in an environment where we were very engaged with the community and thought very far outside of ourselves, quite frankly.
Well, I know when you're thinking about solving problems, you got to start with the business of the health center, but at the same time, you've got to think about the population you serve. I'm thinking of people who live within a few blocks of the Dimock Center, but they could be living somewhere beyond that as well. What do you see there?
Yeah, I think the key thing there is we are primarily focused on the 19,000 patients that we call our family here at the Dimock. And so we're completely focused on addressing the really complex and unique needs of that group. So that's our primary focus. That demographic continues to change, right? And we are continuing to respond to that change. And in this context of this pandemic, the needs continue to change, and those underlying needs are becoming even more challenging to meet. So that's a real part of our focus.
Well, one of the things you're doing is testing for COVID-19. Tell me a little bit about that and how it's helping people.
Yeah, it's been amazing. Through our partners, we've been able to really meet that demand in an amazing way. So we've been able to ramp up testing such that we've been able to identify those cases early enough, which is a key part of this. But not only are we testing, we're also promoting the message about the importance of testing, the importance of mask wearing, the importance of doing all the things to keep individuals safe, families safe, and the community safe.
What about food relief?
That's another huge component. This is a good part about how we've been able to respond, how we've been able to organize and creatively problem solve. I mean, food insecurity has been an ongoing issue. You layer this on top of it, the job loss and the isolation. We've been able to meet those needs in amazing ways. And again, a lot of it really is through the amazing partnerships that we have. But we've been able to do those things, and we look forward to doing even more of that.
Well, the Dimock has an early education component, and that's been an important part of your previous background too. What's going on with that right now?
Yeah, the in general, education's being challenged right now. We do know that. Remote learning works better in some communities than others. And the reality is, I'm very concerned that these gaps that we're seeing, that we've always seen in terms of education, are just getting wider. Some of the things that we're doing is we're starting to really explore how we can leverage these new tools that are about how we create hybrid environments for learning and other things to be able to meet those needs. But it really is not about just taking the same tool that's being used in other communities and say we're going to use it the same way. We've got to really engage our team as we're doing to think through real appropriate ways to use those tools. But let's also remember, I mean, one area I've spent a lot of time in is early intervention, and from multiple angles. Had our son was born at 3 pounds 2 ounces and just shy of 32 weeks, so we had the opportunity to appreciate early intervention from that standpoint. But I've also built programs in my past life to support families who really have children who have a range of needs that go beyond what the traditional system is able to address. We're actually looking at how we take what we've already been doing there and do it even more effectively.
I know remote education can be difficult enough for teenagers who are used to spending a lot of time on the internet or on their cell phones. But what about early education? Because I've heard over the years how important it is for young children to have this direct in-person engagement with a lot of verbalizing going on at the same time. How do you match that under pandemic conditions?
Yes, we're still that's a huge concern, isn't it? Because those early years, age 0 to 3, is when so much of the architecture of the brain is developing, and that's when so many of these social emotional skills are being really just fine tuned. It really is such an important critical part of development, and I'm very concerned in situations where we're not able to get those kids together in environments. We're actually still doing some of that, of course, at the Dimick. But the reality is, for many families, it's been hard to juggle all of these things to take even full advantage of that. And that's where I'm really challenging our team to think about how we recreate ourselves and come out of this even stronger, because the needs are going to be even greater. But you're absolutely right. I mean, those early days of interaction among children and adults in that early ed environment is just so critical. And it's something we're really trying to make sure that we're filling the gaps in.
Well, another gap to be filled is the vaccine gap. And I know you're not Fenway Park or the Reggie Lewis Center, but you have some buildings, you have some grounds, maybe some room to set things up. So what about the possibilities there for the Dimick being a place for people to go to for
Sure.
vaccines?
Well, right now we're actually doing that sort of inventory of our space, and we're trying to figure out where's that space on our 9 acres that would allow us to become a place where we can meet those needs and make sure that there's equitable access to this vaccine. That's something I think is really, really important here. It's great to have the Fenway and Gillette, but for many families, making that hike just makes it more of a challenge. For many families, coming into an environment where you don't have that same sense of trust can be a real barrier. So it really is imperative for us to find ways to do that on our campus. So I've got our team right now looking at just that. But it's not just the space. We need supply. We need a steady supply of this vaccine, and we need the staff to be able to do that. So we're reaching out across a range of partners to help us be able to do that. But we know it's going to be vital and important in this process for us to be there for this community.
Well, infrastructure side, I want to ask you about trust. What do you see the Dimick's mission as far as overcoming the trust barrier among the people you serve?
Sure. Well, I mean, we are definitely been a trusted source of healthcare and health information in this community for a very, very long time. And I think it's going to be important for us to continue to identify that that is a huge asset for us. And it's a huge asset for this community to have a trusted place and a trusted source in the midst of all this confusion. So we're actually actively now looking at ways to shape the communication that's being distributed to be able to combat some of the miscommunication and to be able to do that through trusted faces, both in the community as well as with trusted faces on our campus. So I think this is really clear. I mean, there was a fascinating Harvard study that looked at vaccine hesitancy, and the biggest factor through all their elaborate analysis that explained this hesitancy was what? Racial discrimination. That's what we're dealing with here. And I think that's where a place like the Dimock has always been part of that solution.
Finally, one other question about hesitancy, and this is about all of us, because earlier last year we were all being told to stay home, don't go anywhere, especially if it involves going into a building and being around other people. So now you've got all this backlog of care that people have put off. As far as the Dimock is concerned, what should people be thinking right now?
Yeah, I mean that is going to be that's what I call the ongoing and exacerbation of the epidemic that was already in place that's now being even more challenged during this pandemic. I mean, the delayed diagnoses of something that we know is treatable and preventable and that no one should die from, like colon cancer or prostate cancer. As we start to see the delay in those diagnoses, we know what we're going to have on the other end of that. So, one of the things I really implore people to do is to not put those things so far on the back burner that we get so caught up in the pandemic, which is important. There's no doubt about it. But we have to really understand that beneath that, we still have all of these other things that need to be attended to. At the Dimock Center, we're actually actively keeping those things front and center. So we've got our team completely focused on not only the things that we've always done in terms of those levels of prevention, but thinking creatively about how we can actually do that at a much higher level. How can we actually connect the dots for people in a much more significant way? How can we do the sort of outreach and care management that's going to be required to bring people back into this system of consistent care? That's really going to be the challenge for us. And, that's why I always talk about this and that, yes, we've got this pandemic that's impacting all of us. There's no doubt about it. But there are segments of our population that have already been dealing with a pandemic state. And this is just one of those things that you take this and layer this on top of it, and it's going to widen these disparity gaps. We know it, and we've got to be there to create solutions for solving these problems.
Finally, doctor, if people want to follow up on that advice, is there any way they can do that by going online or even calling a phone number?
Yeah, we actually have a website, of course, at the Dimock Center, and we're always there and available with information on that site. But we also make it easy for people to access our resources as well through that site. So I would encourage people to continue to see us as that trusted source of information and that place where we have providers who show up every single day, and not just our providers in terms of our doctors, nurses, nurse practitioners, but even those who are managing our facilities, who are there to serve. And we're here just as the way we always have been for the last 150 plus years.
And I know all I had to do was just Google the Dimock Center. Thank you very much for taking the time to join us.
Great. Thank you.
That was Dr. Charles Anderson from the Dimock Center. We'll have more news in just a moment.